Hey y'all. So I'm doing this video because I've had quite a few people tell me that they didn't understand what I was talking about when I was talking about the predominant reproductive hormones in women. There's so many hormones in our bodies altogether, but this is specific to like the reproductive cycle hormones. So I just wanted to touch on those. So when you go talk to your doctor, you'll know, you'll understand, you'll know what they're talking about, and you can speak to it as well. So there are four different hormones that we have every cycle. And the first one is FSH, which is follicle stimulating hormone. And that basically is the hormone that makes your ovaries produce ovum or eggs, and they produce them and they make your hormones, they make your eggs get larger. They're like feeding them almost. So if you ever have IVF, you'll have injections that are similar to FSH, or they might actually be FSH. I'm not sure, but they're making your eggs grow. Of course, the difference between IVF drugs or fertility drugs is that they're making probably, hopefully, more than one egg grow at a time. FSH typically makes one egg go to be the dominant follicle, and that is the follicle that will release during ovulation. Now, what actually makes ovulation happen is a hormone called LH, or luteinizing hormone. And that literally is a hormone. It builds, and then you might have up to 5 fertile days, and it depends on you. Everybody's different. But you'll have a few days of high LH days, and then you'll have a peak day. So if you're ever testing for your ovulation, this is what it's testing for, the LH. And then that's when you'll see that you'll have some days that are a little bit, they look like they're close, but they're not quite as dark as the control line. And if you've done the pee on the stick with the ovulation test, you know what I'm talking about, but it won't be quite as dark as the control line. That's when it's building, and that's LH. When it peaks, that means you're ready for ovulation, and that is the hormone that actually helps release your egg into your fallopian tubes and down into your uterus to be fertilized by a sperm. Next would be estrogen. Estrogen, we've all heard of. You might also hear it in your doctor's office as estradiol, especially at a fertility's office. They always say estradiol. I don't think I've ever heard them say estrogen, but I don't know. But basically, estrogen does a lot. Does a lot. But one of the main functions of estrogen is that it builds your lining for ultimately implantation of an embryo. So that's a fertilized egg. It implants, it builds the lining. So that's your endometrium. And it builds that lining so that the embryo has somewhere to go and burrow into your lining and implant. And that's where it grows. That's where it starts. So that's estrogen. Of course, it does a lot more than that. But as far as reproductive, that's one of the main things. It really does a lot more, honestly. And then we also have estrogen, progesterone, which is it's produced after ovulation. So successful ovulation happens, your progesterone typically goes up a couple days later. Once it gets to a certain level, that's how we know ovulation was successful. And then it'll continue to progress and get higher if you're pregnant. If you're pregnant, it'll kind of plateau, but that's the pregnancy hormone you'll hear. It's a pregnancy sustaining hormone. Progesterone needs to be there in order to have a successful pregnancy. So, and I'll give you an example. My progesterone dropped in my first pregnancy. I've had 2 miscarriages. It dropped in my first pregnancy, and my body was no longer able to sustain the pregnancy because we didn't know that I had an issue. So your progesterone has to be at a certain level in order to sustain a pregnancy. So your progesterone is your pregnancy hormone. We also have testosterone, which we all know as the male hormone, but testosterone is extremely important for women's fertility as well. If it's too high, we'll be off. If it's too low, it won't be quite right either. So we need our testosterone somewhere in the middle. And you also hear about DHEAS, and I'll talk about that in a video later, because DHEA is extremely important as far as, especially when you're getting older like me, but DHEA is important with your egg reserve, your egg quality is better said. So you need to have those things checked when you go to the doctor, when you go, always be your own advocate, and you should know your numbers, and they should always fall in the normal range. FSH, if it's too high, it can be an indication of PCOS. PCOS is a fertility challenging, I don't know if it's a disease, but it surely has to be some type of disorder. But PCOS is where there's multiple cysts. It's actually polycystic ovarian syndrome, that there's multiple cysts on your ovaries, which is not great. It can make things more challenging, but it does not make pregnancy impossible. So you want to make sure that your FSH is in line. Your LH, if it's too high all cycle, it will have ebbs and flows. Even at the end of your cycle, your LH may kind of jump up again, not peak, but it'll go higher, potentially depending on your body. But you want to make sure that it's not too high. If it's too high, you will not be able to ovulate. Your body won't know what to do. And then your estrogen, I'm estrogen dominant, so my estrogen is typically always high. Typically people that have endometriosis or fibroids like I do, you may have, you likely are estrogen dominant. And then of course your progesterone, you want that to be, in the beginning of the month, it may not matter so much, but toward the end of the month, during your luteal phase of your cycle, it should be raising. So I'm not a doctor, but that's why I'm doing these videos, is because I want you to be your own advocate when you go see your doctor. If you feel strongly about something, or if you have a little piece of information, I think knowledge is power. So if you know, at least you know where to go. You know how to move and navigate your own journey. This is your journey. Just like I'm dealing with my journey, you're navigating yours. And you must be your own advocate. So know your numbers. I'm big on that. Go to the doctor every year and know your numbers. Have your blood drawn. Ask. And there are also some at-home fertility tests that you can take. I say fertility tests. You can have urine samples taken so that you can see what your hormone levels are as well. So those will help getting you on the right path on your journey. Okay, so if you have any questions, or if you have anything to say about your hormones, or anything you want to ask me about mine, because I'm pretty much an open book, then leave it in the comments. We'll look forward to hearing from you, and we'll see you next time.